Heroin use in Kensington, Philadelphia. I recently spent the day in Kensington, Philadelphia, where I found many victims of heroin use. My first encounter was with Shiz, a redhead dressed in blue, who had just come to Kensington to buy heroin. I also met Kevin, a short, wild-bearded man who kept scratching his arms. One arm was swollen and foaming. I was worried. But I kept noticing him and his chubby little friends. Kensington is a dangerous area for kids. For decades, drug addiction and other issues have plagued Kensington, an inner-city neighborhood that is 2.5 times more poor than the rest of Philadelphia. Wide availability of prescription opioids has only made the problem worse. The neighborhood was notorious for drug overdose seeker deaths. There were as many as 75 to 125 opioid addicts living in makeshift homes. Despite this, many kids still grew up in the neighborhood. In the early 2000s, Dominican gangs brought in Colombian heroin to the neighborhood, which was purer and cheaper than Asian heroin. Since the market was decentralized, prices remained low and competition high. Previously, drug corners in Kensington were operated by small, unaffiliated groups. As a result, the prison system has been the city's largest provider of drug treatment and rehabilitation, and police in the area spend many calls with Narcan to stop overdoses. In the last few years, Philadelphia has taken measures to curb the problem, including clearing the streets of drug encampments and improving access to treatment and housing. The city's Resilience Project, a non-profit that aims to reduce drug use and homelessness, has expanded their programs to serve people in the Kensington neighborhood. In April, the city cleared 2 encampments and began a pilot program in the Kensington neighborhood. The initiative included better access to drug treatment and encampments with few rules. Attorney General Josh Shapiro recently announced the arrest of 3 drug dealers in the neighborhood who were trying to sell heroin to high school students. Police also seized an AR-15 and 76 grams of heroin. The arrests resulted in the seizure of over 6 kilos of heroin, fentanyl, a gun, and 76 grams of cocaine. The arrests were made at a Kensington neighborhood school. The opioid crisis in Kensington has caused many children to become homeless and at risk of overdose. The city opened emergency warming rooms and worked with community groups and outreach organizations to combat the problem. A needle exchange is now run by a non-profit called Prevention Point. Initially a community space, it serves hundreds of addicts from the surrounding neighborhoods. It hosts a free needle exchange on most days of the week. Lack of treatment facilities. If you live in Kensington, Philadelphia, Pennsylvania, you may not be aware that there are no heroin treatment facilities. There are some prevention centers, such as Prevention Point, which offer support and care for heroin addicts. Some community members see treatment as competition with the drug market, while others fear the change of a residential neighborhood. Unfortunately, addiction services are historically separate from other aspects of healthcare, making the "not in my backyard" problem a major barrier to treatment. Because of the lack of access to affordable, effective heroin treatment facilities in the neighborhood, the city is focusing on tackling the problem from all sides. Prevention Point offers a variety of resources for addicts, including drug and alcohol treatment. Besides providing drug rehabilitation services, Prevention Point also provides naloxone kits in case of opioid overdose, sterile syringes for reducing the chance of infection, and HIV/HCV testing and treatment referrals. The Kensington Avenue neighborhood in Philadelphia has been a long-time victim of the heroin epidemic. More than half of its residents live below the poverty line, and the drug problem is more widespread than in other neighborhoods in Philadelphia. The wide availability of prescription opioids has only made matters worse. In fact, Kensington became a destination for heroin addicts from outside the neighborhood. Many end up staying in the neighborhood to feed their addiction. In recent years, the city of Philadelphia has seen its rate of overdose death skyrocket. Its rates of opioid overdoses have surpassed the peak of AIDS deaths in 1994. Philadelphia has 1/5 of Manhattan's population and nearly as many overdose deaths as the entire city. The city has a long-standing opioid crisis affecting residents of all backgrounds. By addressing this problem on a medical level, treatment providers can help the community overcome the crisis. Cost of opioid misuse. The growing epidemic of opioid misuse is causing a staggering number of deaths and injuries. The cost of this epidemic has been estimated to be at least $1 trillion in the US and as much as $500 billion within the next 3 years, according to a recent study by the Alterum Center for Value and Healthcare. The costs are not limited to the direct impact of addiction, however. In Philadelphia alone, costs associated with the opioid epidemic have risen to nearly $100 million. The Kensington zip code is the epicenter of an open-air drug market that supplies illegal drugs to residents. This area has also become an infamous supplier of pharmaceutical painkillers. In fact, Kensington's 19134 zip code sold more opioid pills per capita than any other county in Pennsylvania. In some neighborhoods, such as Kensington, independent pharmacies accounted for more than 80% of those pills. Some neighborhoods are suffering more as a result of the opioid crisis than others. The rate of overdose deaths in Philadelphia has increased over the past decade. It tripled in the past decade. In fact, Philadelphia's overdose death rate surpassed the peak of the AIDS epidemic in 1994. Philadelphia has 1/5 the population of Manhattan, yet suffers nearly as many overdose deaths as the city. Despite its difficult socioeconomic challenges, Philadelphia has a persistent opioid problem. The city's mayor has committed $36 million to help address the crisis in Kensington. The money is part of a public-private partnership to fight the opioid epidemic in Philadelphia. The money will be used to support initiatives that address the root causes of the problem and create a sustainable long-term solution. As a result, the drug market in the area has grown in recent months. This, in turn, has spawned a massive increase in overdose deaths in the neighborhood. While Kensington and South Philadelphia are relatively safe neighborhoods, there are still several problems that can cause an overdose. One of these is the increased number of opioid prescriptions in the area. People in these areas typically work in physically demanding jobs and are already coping with chronic pain and addiction. Most people with opioid use disorders live in the same neighborhood, with jobs, families, food, and housing. In spite of this, there are fewer overdose deaths in South Philadelphia than in Kensington.